Hello everyone, my name is Hospicio. I'm going to present to you guys the use of fluoroquinolones, antibiotic therapy such as Cipro, and generic name is Ciprofloxacin. The quinolones are a family of synthetic broad-spectrum antibiotic therapy. Quinolones are derivatives and isolated from natural sources such as plants, animals, and bacteria, and can act a natural antimicrobials or signaling molecules. They have an effect by preventing bacterial DNA from unwinding and duplicating. How do fluoroquinolones work? They intrude the action of DNA enzymes, which causes bacterial cell death, and they act as a broad spectrum activity. Examples of medications such as Cipro, levofloxacin, moxilofloxacin, and norfloxacin, and gemifloxacin. There's some contraindication when taking this medication, such as known allergies with fluoroquinolones, pregnancy category C, which means they have potential benefits from using the drug despite of potential risks, and also should be cautiously used for women who are lactating, and also patients who have renal dysfunction and liver dysfunction. Pathophysiology, they interrupt or inhibit bactericidal activities of topoisomerase and topoisomerase 4. Those two are fundamentals in bacterial repair, replication, and transcription. And the medication can be consumed via GI tract or intravenously and metabolized in the liver and removed in the urine or feces. Fluoroquinolones are the first drug of choice for urinary tract infections, respiratory infections, GI infections, STDs. There are more than 8 million people who get visit in the urgent care or the ER just for the urinary tract infections, and it should be taken care of. It's first drug of choice for gram-negative bacteria such as Pseudomonas, E. coli, which is the most common, P. mirabilis, K. pneumoniae, and Staphylococcus aureus, Group D streptococci, and many more. Administration, we can give it via IV, oral, or topical forms. IV onset can go to 10 minutes and pick up 30 minutes, and duration of 4 to 5 hours. Tablet oral onset varies and we pick up 60 to 90 minutes and duration of 4 to 5 hours. And it can these medications can cross placenta and enter breast milk. The therapeutic goals. There's the half-life, like I said earlier, I just mentioned that to you guys, the oral route, also intravenous route, and both of them, they have a duration of between 4 to 5 hours. As nurses, we want to make sure we did culture sensitivity tests in urine or blood, and we want to make sure to tell our patients to continue therapy despite feeling better, and we want to keep the patient hydrated and complete the full course, because sometimes when they feel better, they stop taking the medication, and then the symptoms come back, and next thing you know, patients are already resistant to that medication. And there are some medications such as antacids can influence the absorption of the medication, so we want to make sure we tell them that to take antacid 2 hours before after the dose of the antibiotic. The medication can also have some kind of effect on the renal and liver functions, and so we want to make sure we check our AST, ALT, BN, creatinine for the patients. There are like adverse side effects of this medication. The common is nausea, vomiting, sometimes diarrhea, insomnia, dizziness, headache, pruritus. But if it's a severe rash or edema or anything like that, or difficulty breathing, you make sure to stop the medication, go to urgent care or ER, and most likely you're allergic to that medication. Additionally, like I said, can affect lab findings and can cause liver enzyme and decrease liver functions. Drug-to-drug interactions. If you're taking it with theophylline, it can increase the theophylline plasma concentration, and this can be toxic and can cause confusion, blurred vision, nervousness, dizziness, and also if you take this medication with dilantin, and it can cause increased concentration of the dilantin level and can cause symptoms such as nystagmus, drowsiness, lack of coordination, nausea, and vomiting. Like I said too, there are medications that or some kind of supplements that influence the absorption of fluoroquinolones such as sucralfate, calcium, iron, zinc, and antacids. Cultural consideration. We should look into patients' beliefs about health, illness, and medications. For example, the patient has different ethnicity. Is it okay for them to take the Cipro despite of the possible side effects of the medications? You want to make sure there's effective communication between the patient and the healthcare providers. Also, we want to make sure, reiterate that patients should take the full course of treatment because other ethnicities or background may think that once they are feeling better, they can stop the medication. That's not how it works. We should look also into cultural preferences or rituals that may affect how our patients taking the medications. Also, we want to make sure we ask questions, for example, like how do you feel about taking the medication? How do you feel about taking this particular medication and all that? I saw an article just regarding ciprofloxacin, like taking it for 7 days versus 14 days in women with acute pyelonephritis. Since pyelonephritis is common in adult women. In this study, they took they recruited people, and the eligible ones are patients who are symptomatic with 30 degrees Celsius temperature, symptom of CVA tenderness, pain upon urination or dysuria, urgency, and flank pain. They're looking at which one is better, the effectiveness between taking Cipro for 7 days or 14 days. These are used for patients diagnosed with acute pyelonephritis, and they use medications such as giving ciprofloxacin 500 twice a day for 7 days and 14 days. And the results was taken. So they took the data who took the 7-day course from day 17 to 21. And for patients who took 14-day course, they took the data from 24 to 28 days. And they repeated urine culture, had either blood tests such as CRP and creatinine concentration. And there were like 248 random patients. And there are like 126 patients. There are like 97% cured for the 7-day course of Cipro, and 122 patients, 96% treated for 14 days. But sometimes when you're taking the medication, the more days you take it, I know that they stated also that they ended up having like getting oral thrush. So I think they still recommend 7-day course of Cipro compared to 14 days because also there's high incidence of resistance bacteria in women. Also, in that, based on that results earlier, it is recommended as a first line of choice for empirical oral treatment for acute pyelonephritis, which is Cipro. There's another article that I looked into. the name of it is Current Issues in Management of Urinary Tract Infections. So in this article, they have patients who have symptomatic UTI, and which is a concern, and they use fluoroquinolones as recommendation compared to cotrimoxazole resistance because of the cotrimoxazole resistance. Even though that medication is their first line of choice for UTI, but there's still that high incidence that they develop resistant from cotrimoxazole. Also, they found out there's higher plasma concentration with extended release ciprofloxacin. Study shows that there are low CIP resistance, and the IDSA recommends, which is the Infectious Disease Society of American guidelines, recommend citronimoxazole as first choice, then fluoroquinolones if indicated. Extended release Cipro should never be crushed, and there are higher urine drug concentration and plasma concentration for for ciprofloxacin, which is the extended release. And also they stated that there's an impressive bacteriological activity against pathogens for extended release Cipro. So they're also saying that ciprofloxacin daily is better than to take 250 milligrams twice daily for Cipro immediate release for uncomplicated UTIs. And there's lower incidence of adverse effects, and the drug interaction is still the same as the conventional immediate release formula. So that's it for my sliding presentation. This is my references. Thank you. And also I'm gonna show you my brochure that I did for fluoroquinolones, and it shows that, you know, how the action, the fluoroquinolone drugs, they interfere with DNA replication, how they work, and the administration form, the onset, the IV onset, and what it's used for, and the special consideration, like I said right here, food interaction and side effects that you could see, and drug herbal interaction, and the dosing part I also included that, and also the follow-up if the patients experience tremors, severe GI problems, or rash, or visual changes, or difficulty breathing, patients should go to emergency ER or urgent care right away and get treated. It can be life-threatening too. And I hope that's it for my presentation. And thank you so much.